Welcome to a journey into one of the most important aspects of personal health, taking care of your teeth and understanding the science behind dental caries, more commonly known as tooth decay or cavities. Oral health is something many of us take for granted, yet it plays a vital role in our overall well-being, daily comfort, and confidence. Whether you're a patient seeking information, a parent looking out for your child's health, or simply someone interested in learning more about how to maintain that healthy, radiant smile, understanding dental caries is essential. Dentistry, the medical field devoted to the health of our mouths, teeth, and gums, is about much more than just fixing teeth. Dentists are highly trained professionals who diagnose, prevent, and treat a wide range of conditions affecting the oral cavity. Their work involves not only repairing damage, but also helping you avoid problems before they start. Think of dentists as your partners in maintaining lifelong oral health, guiding you with advice, treatments, and preventive care to ensure that your smile stays both beautiful and functional. Let's take a closer look at what makes up a tooth. At first glance, a tooth may seem simple, but it is a remarkable structure composed of several distinct layers, each with its own unique purpose. The outermost layer, called enamel, is the hardest substance found in the human body. Its strength is crucial, as it serves as the tooth's primary defense against the forces of chewing and the constant assault of bacteria and acids. Beneath the enamel lies the dentin, a softer yellowish layer that is still quite strong but not as resilient as enamel. At the very core is the pulp, a soft tissue that contains nerves and blood vessels, providing the tooth with nourishment and the ability to sense temperature and pain. Unfortunately, this sophisticated structure is under constant threat. Dental caries, or cavities, are the most widespread dental issue in the world, affecting people of all ages and backgrounds. At their core, cavities are caused by an intricate interplay of bacteria, diet, and hygiene habits. Our mouths are home to millions of bacteria, some of which are harmless and even beneficial. However, certain types of bacteria thrive on the sugars and starches left behind from the foods and drinks we consume. When these bacteria metabolize sugars, they produce acids as a byproduct. It's these acids that are the true culprits. They attack the tooth enamel, gradually dissolving it and leading to the formation of tiny holes, or cavities. The process doesn't happen overnight. In the beginning, the acid may only cause minor demineralization of the enamel, which can sometimes be reversed with good oral hygiene and fluoride exposure. But if the conditions persist, if sugary snacks and acidic drinks are frequent, and brushing and flossing are neglected, the acid continues to erode the enamel, eventually creating a permanent cavity. As the decay advances, it can penetrate into the dentin, and if left unchecked, reach the sensitive pulp. At this stage, toothaches, sensitivity, and even serious infections can occur, sometimes resulting in abscesses or tooth loss. Recognizing the early signs of dental caries is crucial, but it can be tricky. Often, the earliest stages produce no noticeable symptoms. As a cavity grows, you might begin to experience increased sensitivity to sweets, hot or cold foods and beverages, or notice visible holes or dark spots on your teeth. Pain when biting down or lingering discomfort after eating can signal that the decay has reached deeper layers. It's important to remember that regular dental checkups can catch cavities before they become painful or visible, making treatment simpler and less invasive. Prevention, as the saying goes, is better than cure. Fortunately, preventing dental caries is straightforward when you understand the key steps. The first line of defense is maintaining a consistent oral hygiene routine. Brushing your teeth twice a day with fluoride toothpaste helps to remove food particles and plaque, a sticky film of bacteria, from the surfaces of your teeth. Flossing once a day reaches the areas between teeth where a toothbrush can't, preventing decay from forming in those hidden spots. Diet also plays a significant role. Limiting sugary snacks and drinks, especially between meals, reduces the fuel available for cavity-causing bacteria. Drinking plenty of water, particularly fluoridated water, helps wash away food debris and bacteria while also strengthening teeth. Fluoride, a naturally occurring mineral, is especially important. It not only helps to rebuild weakened enamel, but also makes teeth more resistant to future acid attacks. That's why most dental professionals recommend using fluoride toothpaste and, in many communities, drinking fluoridated tap water for children and teenagers whose teeth are still developing and who are often at higher risk for cavities. Dental sealants provide an extra layer of protection. These thin protective coatings are applied to the chewing surfaces of the back teeth, where the grooves and pits can trap food and bacteria. Sealants have been shown to dramatically reduce the risk of cavities in these vulnerable areas. Despite our best efforts, sometimes cavities still occur. The good news is that dentists have a range of effective treatments. The most common is a dental filling, where the decayed portion of the tooth is removed and replaced with a durable material such as composite resin, amalgam, or porcelain. For more extensive decay, a crown, a cap that covers and strengthens the entire tooth, may be necessary. If the decay has reached the pulp and caused infection, a root canal procedure can remove the damaged tissue and save the tooth. It's important to address cavities promptly. Untreated tooth decay can lead to serious complications, including painful abscesses, difficulty eating or speaking, and even systemic health problems. Children are especially vulnerable, as dental pain can interfere with nutrition, learning, and overall development. The best news is that dental caries are largely preventable. By embracing good oral hygiene habits, making thoughtful dietary choices, and visiting your dentist regularly for professional cleanings and checkups, you can protect your teeth for a lifetime. Every small step adds up, whether it's brushing for 2 minutes, choosing water over soda, or scheduling that regular dental visit. Remember, your smile is one of your most valuable assets, a reflection of both health and happiness. Protect it with knowledge, care, and a commitment to lifelong oral health. Here's to keeping your mouth healthy and your smile bright, today and every day.